name. We need a better name. So
double switcher. So what are you doing?
Maybe in the YouTube comments. Are you filming right now?
Uh-huh.
Maybe in the YouTube comments, you guys, everyone come up with a better name than double switch at wall. All right. So whatever. Let's see what you come up with.
Yeah, we've come up with some good ones. Monkey pushes.
Monkey pushes.
All
right. So
hag breakers.
This exercise is really good for plantar fasciitis, re-engaging the hip flexors, derotating any kind of external rotation in the lower legs, especially in the tibia and the femur. So it's reactivating proper kinetic chain function between the hips and the lower legs. What you will need is a ball or a yoga block, a belt or an adjustable strap. Okay,
you want to do it with the belt? So you can show it how it's done?
Yeah.
Just so you can, people are not going to necessarily have a strap, so show us how it's done with a belt.
All right. So you're gonna want the belt to be able to come to about 2 fist width distance between the ankles. So strap the belt like that, and if your belt doesn't have a hole, what you can do is you can actually feed it back in. I do that like these. You kind of make a loop like that, loop it back around, and then tighten it up, and you'll have resistance on the belt. So take your ball, and I've even used a shoe to do this. So you just need something like a water bottle, whatever, in between. You can get these from like your drugstore for like $1.25.
$1.25.
Okay, so your feet are going to be on the wall. You're going to be as close to a 90 degrees as possible at the knees and at the hips. Place the ball in between your knees. Now, you're going to lie down. Make sure that your upper body is not sideways. You want to try to be as centered as possible. So what you're going to do is, the first thing you're going to do is you're going to rotate, kind of slide. Sorry, you want to actually make sure that the outer edge of the foot is actually vertical. So this might feel quite pigeon-toed to a few people. So the ball of your foot right about here on the bottom is going to be the pivot point of the foot. So I'm going to be sliding the heels away from each other like this. So I'm not sliding the foot like that, making sure I get this pivot point. And you can see how my knees naturally go in as I do that. So placing the ball here, as I push out and I squeeze the ball, I'm going to get a contraction in this musculature right here in my hips. So it's providing internal rotation of the femur and internal rotation of the tibia and the fibula. So I'm going to push out and squeeze the ball and then release both. Push out against the strap, squeeze the ball, and then release both. So it's a pulsing. And what you want to do is you don't want to go and create a lot of tension through your whole system. You want to lightly do it and then release. And I emphasize the word lightly to moderately because the more you contract your body, the more tension it creates and the less you can feel whatever type of dysfunction you have. Because what you want to look for, more importantly, is how one side is more dominant than the other side. And the side that's dominant is going to try to take over. And that's gonna throw the hips off. So what you want to do is you actually want to lighten up that dominant side to its equal to the less dominant side. So you're pushing out against the strap, and then you're squeezing the block, and then you're releasing. The lighter you go, the more neurological symmetry you'll get. Rather than, this is not going to build muscle, this is going to build stabilization and proper neurological symmetry. All right, do about 60 to 100 reps, or start out at 30. Just do what feels right to you. Also, a note on the pelvis, if your back is flat, if I turn my pelvis this way and I flatten my spine, that's not ideal. You want to be able to let the pelvis go into more of a neutral position. I don't want an excessive tilt. So right now, excessively tilting my pelvis into an anterior tilt, so that my spine is really off the floor. What I want is especially this part of the spine to be on the floor, but this part of the spine to be slightly off the floor. If it's flat against the floor and you're contracting your stomach, it's no bueno. You want to be able to have relaxation in the stomach every time you contract. Otherwise, if you're contracting the stomach, you're actually stealing the function from your hips with the stomach. So push the ball in, push out against the strap, release. Give it a go. Don't forget to help us name this exercise because double switch at wall is not so great.
Crush the ball, crush the heels.
And don't forget to subscribe to Bodyline Pro, man.
Do it!